Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
In the intricate tapestry of life, where aspirations and objectives intersect, family planning emerges as a purposeful component. Embarking on the journey of responsible reproduction resembles orchestrating a symphony, where women and couples, equipped with knowledge and choice, compose the harmonious melody of their familial destiny. Family planning empowers women with the wealth of informed decision making and the ability to shape the future. In this thoughtful approach to family planning, birth control pills play a nuanced and a pivotal role. Welcome, everyone. I'm Dr. Samya Saluja from THIP Media, and today we'll be discussing birth control pills. Joining us to provide insight on this topic is obstetrician and gynecologist Dr. Shiba Mittal. Dr. Shiba Mittal is a dedicated and vibrant obstetrician and gynecologist with over a decade of experience in the city of Chandigarh. She specializes in handling infertility, adolescent health, recurrent miscarriage, and menopause. With extensive experience in gynecological procedures, Dr. Shiba excels at addressing various women's health concerns. Ma'am has safely overseen numerous vaginal and C-section deliveries, demonstrating her commitment to maternal and infant well-being. In addition to her clinical work, Ma'am actively contributes to discussions on essential topics such as menstruation, reproductive health, hormones, and contraception on platforms like Instagram. Her engagement reflects both medical expertise and a passion for raising awareness about women's health. Dr. Shiba stands out as a multifaceted healthcare professional, bridging the gap between medical knowledge and public understanding. So, Dr. Shiba, THIP Media welcomes you, ma'am.
Thank you so much. Thank you, Soumya.
Thank you, ma'am. And ma'am, as we know that family planning is a very significant contributor to not only population control, but also to a mother's health, right? So I'm going to start this discussion by asking the most fundamental question. Okay, what are these birth control pills? And why do they hold such widespread popularity as a contraceptive method?
So basically, birth control pills, they are a combination of hormones, which is basically synthetic estrogen and progesterone. And they are a very, very good method of contraception because number one, they are easily available, they are easy to use, they are highly effective, they are very cheap, and the visit to the doctor need not be very, frequent. Like the supervision need not be very, very frequent, like
Okay.
every month or so. And
Right.
it has got tremendous non-contraceptive benefits. And one very important thing, it is not partner dependent.
Okay.
So that is really important in today's day and world.
Okay.
So these are the reasons, the oral contraceptive pills are widely accepted as a contraceptive measure.
Okay. And now, taking that into account, I would like to ask that how do they provide reproductive control? You just mentioned that these are not partner dependent. So can you help us understand the mechanism by which they prevent pregnancy?
So basically, their method of since they're hormonal contraceptives, most of them they're hormonal contraceptives. So uh, initially at the basic level, the combination pills they basically prevent ovulation. That is the egg formation. So if the
Okay.
egg formation is not there, obviously the pregnancy will not be there. Then
Okay.
secondly, it also acts at the level of the uterus. It
Okay.
changes the lining of the uterus in such a way which makes it unsuitable for the pregnancy to hold it.
Okay.
And thirdly is the at the mouth of the uterus is the cervix, which has got
Right.
its own secretions which become favorable and unfavorable according to the time of the period. So they make the cervical secretions unfavorable for the sperms to swim up
Okay.
and helps in prevention of pregnancy.
Right. And like you just mentioned about that these usually act, these are hormonal contraceptives. So can you provide an overview of the distinct types of birth control pills which are available? And can you just help us understand the notable distinctions between them whenever a girl or a woman is, they tend to buy a certain type, then what are the different types available for this contraceptive method?
See, first of all, I would like to say that these birth control pills initially, at the time of initiation, should not be bought over the counter. It's
Okay,
always best to visit a gynecologist who will do a
right,
couple of tests or maybe check and do certain examinations before prescribing it. And once
right,
prescribed, it can be continued and accordingly regular follow-up can be done.
right.
So basically, it's of three types. First is the contraceptive pill, the combination pill, which is a
Right.
combination of estrogen and progesterone. It is available under different names, and in which they are estrogen and progesterone are present in different compositions.
Okay.
So and they are the most widely used. Most of the
Okay.
times, different names, different compositions are used by different people. Then second is the progesterone only pill, which is usually recommended at the time of, after delivery. So at the
Okay.
time of lactation, they're pretty
Okay.
safe to use. And
Okay.
the only disadvantage of the progesterone only pill is that, it has to be taken at the specific time of the day.
Mm.
And just a variation of 2 hours here and there can lead to the failure of that pill. So
Mm.
in general, it is not really widely accepted except for at the after delivery. Then third is the non-steroidal contraception, which is centroman or Saheli, and this is also mostly provided to the breastfeeding mothers.
Okay. And does age have an impact on the use and effectiveness of these birth control pills? I mean, if yes, what considerations should women in general take into account, regarding their age when deciding to use this form of contraception?
See, as such, according to the American College of Obstetrics and Gynae, these oral contraceptive pills can be used up to 50 years of age,
Okay.
but with, proper supervision.
Right.
Certain things which need to be kept in mind is that the lady she should not be a smoker. Her lipid profile should be normal. She should not be diabetic. She should not be
Mhm.
hypertensive. And once these things are taken care of, her pap smear should also be normal. So a
Okay.
lady can, continue up to 50, and but the supervision needs to be more frequent. But
Okay.
as long as the effectiveness is concerned, the age is not of concern of that. It is as effective in a 20-year-old as it is in a 45-year-old.
Okay. Great. And is it safe to take birth control pills regularly? And or should they only be used as an emergency medication?
See, the birth control pills are really safe to use.
Okay.
I rather should say that it should not be taken only for emergency, because emergency pill is completely different from regular birth control pill. So
Right.
emergency pill will not be called as a birth control pill of a
Okay.
regular use.
Right.
And uh, when we talk of the birth control pill, certain things need to be kept in mind before starting them. Like there are certain conditions in which it should not be used at all. Like
Okay.
if you have, severe migraine attacks, and if there is history of stroke in the female, if there
Right.
is severe hypertension, any kind of heart disease, valvular heart disease, ischemic heart disease, then diabetes mellitus, then active liver disease like liver enzymes if they are deranged, or if there is history of liver cancer, if there is history of breast cancer, if there is history of thromboembolism,
Right.
and if the lady has to undergo any major surgery in next 6 weeks. So
Right.
these things are taken care of before starting the pill. But once the pill is started, usually it is well tolerated, and it is easy to use.
Okay. And like you just mentioned at the beginning of the session about the various, advantages of these birth control pills. So, in addition to their primary contraceptive advantages, what other benefits can these offer? I mean, do they affect monthly menstruation, or Or can we say that they provide relief from period pain if used?
Yes, it's a very good question. And rather, these contraceptive pills are used for various other non-contraceptive benefits except for contraception. So
Right.
one of the important is, sometimes it's an irregular bleeding, which is,
Mm-hmm.
hormonal bleeding. It is not something like a lesion is there, like a fibroid or something, but unrelated to it. So
Right.
after proper examination, it can be used in those conditions. It also helps to relieve of period pain. Then even in severe conditions of PMS,
Right.
the premenstrual tension is there. So it is used in those cases as well. Then
Okay.
in hirsutism, acne, in polycystic ovarian syndrome, it is used. Then, it also, decreases the pain of endometriosis, fibroids, and, it's pretty good to use. And
Okay.
even a very, very important benefit is that even if you have used it for 6 months or 1 year, it
Right.
helps in prevention of certain ovarian cancers
Mm-hmm.
and certain uterine cancers and colorectal cancers also. Like the benefit
Wow.
can be extended up to 10 years once you stop using it.
Okay.
Yes.
Right. Okay. And in addition to these advantages, ma'am, what are the possible side effects, which are linked to these birth control pills? Are there any?
Yeah, definitely. See, the side effects are there. So I'll talk about the side effects which are, very minor and they can be overcome. Like nausea is a very common side effect. So usually, it settles down within 2 to 3 months, but the newer contraceptive low dose pills have lesser of nausea. Then there could be mood changes, minor mood changes.
Mm-hmm.
Then it could be also increased vaginal discharge or, monilial candida infections could be there.
Okay.
And pigmentation, just like in pregnancy, a few females get pigmentation on their faces. Some of
Okay.
the females can get pigmentation even while contraceptive use. So the
Okay.
counseling needs to be done, like, if they're ready for it or how is it. But there
Okay.
are a few major side effects which need to be really looked into.
Okay.
Like, it could be major depression. Like some females are really not able to tolerate it. However,
Okay.
they undergo major depression and they say we really want to discontinue it. So I think that's pretty fine.
Okay.
Then thromboembolism is there. Then increased blood pressure. Then if the liver function test they get deranged, like it becomes cholestasis or the lipid profile really goes haywire.
Yeah.
So in these conditions, and there's an increase in the migrainous attacks. So in these conditions, it's best to stop the pill.
Okay. And I mean, considering these potential challenges, factors might influence the consistent and effective utilization of birth control pills. I'm going to put it like this: that how can women tackle issues like missed doses and ensuring adherence to a regular schedule in this method of contraception?
See, one of the very important things is the lady, the female needs to be really motivated to take it.
Okay.
And, it is very important to discuss the side effects and with the patient because unless she knows she is confident about the side effects and she is sure that they can be tackled, till
Right.
that time the motivation will not come. So
Right.
the motivation needs to be there. And as I tell my patients, it's best to take the pill at, a fixed time of the day every day, which becomes
Okay.
it very simple. Because
Mhm.
I think at that time of the day is usually the night time. Because in the morning, once the morning starts, the rush hour starts for every female, sending kids to school, getting ready for their work, and even if they are at home, starting the household chores and all, so the whole day is jam packed. And if one thinks कि मैं breakfast के साथ ले लूंगी, lunch के बाद ले लूंगी, there is tendency to forget it.
Right.
So if you take it at night time at a fixed time, so the regularity is more. And missed dosages is really a problem because once someone misses a dose, you really do not know what to do. So
Mhm.
usually if the dose is missed in first 24 hours and you remember it that I have just missed it like taking it last night, so it's best to take it within 24 hours as soon as you remember it.
Okay.
But if it extends beyond it, like if it's what you have not taken today also, you have not taken the next day also, then remember to take it as soon as possible and continue the rest of the pack as such, but use an additional contraception for next 7 days to cover
Okay.
the risk of
Missed.
ovulation and pregnancy. Yes.
Oh, okay, right. And following this cessation of birth control pill use, how soon can, women anticipate the return of their fertility?
That's a very good question because that is in most of the minds of the patients as well. Usually 90% of the females, they ovulate and return to their normal periods within 3 months.
Okay,
So practically what we have seen is that as soon as the pill is stopped, many patients, they conceive within the next cycle only.
okay,
So it can be as early as that. But
okay,
if somehow the things are delayed beyond a year, now the people don't even wait for a year, which is I think good. Even if it's delayed for 6 months, it's best to visit someone and visit a gynec and see how things are for the
right,
reassurance.
okay.
Yeah.
And now, very personal question that coming from a very conservative society, you just mentioned that women also usually are not very, very motivated when it comes to family planning and the use of birth
Hmm.
control pills. So, have come across any misconceptions or let's say unfounded beliefs surrounding the birth control pills that could hinder their acceptance and usage, particularly in the Indian society?
See, one important misconception is regarding the weight gain. So,
Okay,
people are really apprehensive in starting it because they think as soon as they start hormones, they will gain weight. So,
okay,
weight gain, it is very subjective. It may
right,
happen to one female, it may not happen to the other one. And currently, with lower dose contraceptive pills, the issue of weight gain is also less.
okay,
And second important factor is their sexual life and fertility.
right,
So, patients they think that once they take pill for 1 year, 2 year, whatever duration, will they be able to conceive after it?
mm,
Will they find any difficulty? And how is it going to affect their personal life, their sexual life? So, I think return to fertility usually happens very normally.
right,
Mostly the difficulty when it happens is not because of the contraceptive pill as such. It could be because of the hidden disease which has been masked by the contraceptive taken during that time.
G.
And so, it's better to explain it to them.
Mhm. Right.
Yeah.
And as a healthcare provider yourself, I mean, could you help us or could you elaborate on the strategies that the one could employ to to proficiently educate women about the critical significance of the consistent and accurate utilization of birth control pills? I mean, in other words, I would just say that how does this comprehensive patient education enhance their adherence to this use of contraceptive method?
I think in today's day and world, social media is a very good platform in educating women, in
Right,
reaching women to far-fetched places, because I think phones and internet is everywhere now.
correct.
So that is one thing in which the ladies they can be educated in their own vernacular language about the benefits of using birth control, because getting pregnant and then getting the pregnancy aborted
Right.
and it takes a toll on her. So, educating her in for the well-being of the female is very important, and reaching out to her in her vernacular language and supporting the family planning programs which are being run by the government nowadays, because there lot of medicines are provided free of cost. Even the emergency contraception is also provided free of cost nowadays. So educating them that such kind of facility is available,
Right.
because in far-fetched places even emergency contraceptive the people do not know about, because preventing a pregnancy will be it's of immense benefit to all to the society, because keeping in mind the health of the female, which is very very important, not only for her family but for the the social structure around her. So it's the education through the social media, and yes, the family planning programs run by the government and supporting them, they are
Okay.
helpful.
Right. So, Dr. Shiba, that was very, very insightful. And I'm hoping that all of this information will be very helpful for many women and their families. So thank you so much for joining us today, ma'am.
Thank you. Thank you so much, Soumya. My pleasure.
Thank you, ma'am. And
Thank you.
for more such informative videos, please subscribe to our channel and press the bell icon for regular updates. Thank you once again, ma'am.